Hey, what's up, guys? It's Aculus here. Today I want to talk about mental disorders and like mental health and stuff like that. Because personally, myself, I have a lot of disorders and things I deal with day to day. I guess two biggest things that trouble me are I have major depression and bipolar too. But I'll have my phases where I'm really like depressed and but with the right medication and therapy and stuff, it really helps. Um, out in the real world, there's a lot of different mental disorders. There's obsessive compulsive disorder, schizophrenia, multiple personalities, sociopathy, just to name a few, I guess, of the major ones. Germaphobe. And I just want to say, just because people have mental disorders, just because someone's bipolar doesn't mean they're crazy or something's wrong with them. One of my really good friends that I hang out with every week. She was recently diagnosed with bipolar disorder, and she was she freaked out, and she was like in denial, and she's like, "No, I don't want to be crazy." And I talked to her about it. I'm like, I have bipolar disorder, also. So it does make sometimes I'll just be like really like I guess I'll be like really high and like my energy level will be high, and then some days I'll just be really like low. And um, there's really bipolar disorder just means that you'll kind of have your highs and your lows. It's kind of like your mood will just go up and down, and sometimes just switch on the drop of a dime. um, I guess what I'm trying to say is, you can have these mental disorders, like a borderline personality disorder, bipolar, and you can be perfectly fine. I've these people with disorders like I have and my friends have and anybody else, probably people watching this video, um, can live a normal life. I mean, there's really nothing wrong with you. It's just, some of these things are caused by childhood, um, stuff wrong in childhood, kind of like Freudian based philosophy and all the stuff that Freud came up with. On a side note, it's kind of funny. Homosexuality was actually deemed a mental illness until the 1970s. And Freud, who was around during the early 1900s, he actually in 1935 he said that being a homosexual is not a mental illness and it should not be classified as such. It's like saying I'm attracted to a girl. Just because I'm attracted to a girl doesn't make me mentally insane or something. It's the same way with homosexuality. Say I'm suddenly attracted to a man, that's, whatever. So Freud is actually, spot on with that. And now homosexuality is not a mental disorder. But anyway, people with certain disabilities or mental disorders, like I'm trying to say, is don't look down on them, because I'm sure there's people who, especially people with anxiety disorders. I know I've dealt with anxiety, not as crippling as people I've heard and stories I've read, but anxiety, especially social anxiety, can get really bad. It's easy to laugh at, I know when I was in middle school and high school, laugh at the short bus and stuff. Um, but those are mentally handicapped people. But still, I guess it falls in the same category. Let's try not to bash on the people who have mental illnesses. Instead, try to be more understanding, because that's stuff we have to deal with. I mean, the mind is a very complex thing. I mean, a person could study the mind you could have a whole team of scientists study the human mind for years, for their entire life, and there's still gargantuan amounts they will not even be able to wrap their own minds around. So I just want to say, guys, be understanding, because having a mental illness like a bipolar disorder, depression, and some kind of anxiety disorder, it's almost like having a broken bone, or some kind of physical ailment or something broken. That's really all I gotta say. Personally, for myself, I've been to a few mental hospitals, at least 2 or 3, and I've gotten a lot of help, a lot of coping mechanisms, found the right medication for me, and all this stuff can be easily overcome with the right medication and the right therapy. And I think the biggest thing I've learned in dealing with major depression and bipolar and the other stuff I deal with is really just get out there and talk to people, because whatever's on your chest, whatever's holding you down, if you just sit in your bed or if you sit at home or whatever, you just mope around and you don't get it out, then, you know, it's just going to keep stewing inside of you. It's not till you get that stuff off your chest that you feel relief and like release, and it just feels great. So that's all I got to say. That's all I have to say today, guys, and I hope everyone had a great weekend, and that's it. Love you guys. Thanks for subscribing. Message me, comment, subscribe. Bye.